So maybe actually, it's not so much the age we should look at. It's a better descriptive way of looking at people and at their age. And that could be linked to, as I mentioned for this patient, a more cognitive, physical description based on their level of activity, dependency, and maybe also the ASA medical status. So the couple on their way, backpacks, etc., and they can travel, they are probably not particularly age-related, certainly not chronically related in terms of what they need and can do. But when you see the low dependency in the second image, then the medium dependency and the high dependency, well, you could actually be in your 60s and be highly dependent, couldn't you? So maybe that's what we should look at. For certain, when we are in these age groups, we need to bear in mind the physical, the cognitive, the medical aspects, the comorbidities, the polypharmacy, the dental disease, which is a huge problem in those age groups, as well as the self-imposed barriers. Patients who are perhaps not as impressed by all that we have in our dental surgeries now, because actually it makes them feel vulnerable, it makes them quite frightened. Maybe they don't quite feel they should spend money on themselves anymore. Maybe they don't have the family support to confirm that they should spend the money, let alone bring them to the practice. These factors all influence the status of these patients in those age groups. So if we bear that in mind, when I'm now asked the question at this conference, do new techniques facilitate treatment planning in this age group? Well, I'd like to look at it under 3 headings. First of all, the implant considerations. Then the advocated strategies that there are for this age group, and then go into the new technologies.